Welcome to the Emergency Management and Preparedness Inclusion of Persons with Disabilities webinar series. I'm Lewis Krause from the Pacific ADA Center, your moderator for this series. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the CC icon in the Meeting Control toolbar. To toggle the Meeting Control toolbar permanently on, press the Alt key once and then press it a second time. As always in our sessions, only the speakers will have audio. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and use the webinar ID 872-0730-7836. I want to remind everyone that this webinar is being recorded and will be able to be accessed on the adapresentations.org website in the archive section next week. This is the 7th year of this webinar series, which shares issues and promising practices in emergency management, inclusive of people with disabilities and others with access and functional needs. The series topics cover emergency preparedness and disaster response, recovery and mitigation, as well as accessibility and reasonable accommodation issues under the Rehabilitation Act of 1973, the Americans with Disabilities Act of 1990, the ADA, and other relevant laws. Upcoming sessions are available at adapresentations.org under the Schedule tab in the Emergency Management section. These monthly webinars occur on the second Thursday of the month at 2:30 Eastern, 1:30 Central, 12:30 Mountain, and 11:30 a.m. Pacific time. By being here, you are on the list to receive notices for future webinars in this series, and those notices go out 2 weeks before the next webinar and open the webinar to registration. You can follow along on the webinar platform with the slides. If you are not using the webinar platform, you can download a copy of today's PowerPoint presentation at adapresentations.org in the webpage in the Schedule section. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform, and the speakers and I will address them at the end of the session. So feel free to submit them as they come to your mind. Pardon me. You may type and submit your questions in the chat area text box as shown on the screen, or if you are using the keystrokes, you can press Alt and H and enter the text in the chat area. If you are listening by phone and not logged into the webinar, you may ask your questions by emailing them to adatech@adapacific.org. That's ADATECH@adapacific.org. If you have any technical difficulties during the webinar, you can send a private chat message to the host by typing in the chat window and type your comment in the text box and enter. And again, if you are using keyboard, use Alt-H to access the chat box. You can also email those technical difficulties to adatech@adapacific.org, or you can call 510-285-5600. Today's ADA National Network Learning Session is titled A Closer Look, COVID-19 Accessible Materials for People with Disabilities Project. COVID-19 has disproportionately affected many groups, including the 61 million people in the United States living with a disability. As part of the COVID-19 Accessible Materials for People with Disabilities Project, this webinar is focused on strategies and solutions for people with disabilities as they continue to live, learn, work, and play during the COVID-19 pandemic. The CDC Foundation funded project, along with technical assistance from the Centers for Disease Control and Prevention, CDC, supports the Georgia Tech Center for Inclusive Design and Innovation, the CIDI team, on creating accessible materials and resources from existing CDC COVID-19 guidance. The specific targeted disability audiences identified as needing these resources are individuals who are blind and or have low vision and need braille, individuals with intellectual and cognitive disabilities needing easy to read language, and individuals who are deaf or hard of hearing and need ASL. Additionally, resources and helpful guidance has been created for individuals living with mobility disabilities, their caregivers, and families. Presenters will share information about this project, including statistics on individuals living with disabilities during the COVID-19 pandemic, the history of the project, and real-time resources for you as we collectively work to distribute this vital health information to those who need it most. Today's speakers are Carolyn Phillips. Carolyn is the co-director of CIDI and the Services and Education Director for Tools for Life. She is nationally recognized in the field of assistive technology and disabilities. She serves as the director and principal investigator of Tools for Life, Georgia's Assistive Technology Act program, and the co-director of Services and Educations at the Center for Inclusive Design and Innovation at Georgia Tech. Liz Persaud is the MAG Program and Outreach Manager at CIDI. Liz is a nationally recognized keynote, public speaker, and advocate addressing the need to build bridges and solidify the gaps between individuals living with and without disabilities. She currently serves as the Program and Outreach Manager for Tools for Life, Georgia's Assistive Technology Act program, and the Pass It On Center, the National Assistive Technology Device Reutilization Coordination and Technical Assistance Center at the CIDI with the College of Design at Georgia Tech. Sam Peters is a program specialist at Tools for Life. As the program specialist, Sam assists in coordinating state leadership activities such as trainings and outreach, as well as assisting in overall daily programmatic activities. And this includes trainings for various grants and organizations throughout Georgia and assistive technology labs at state and national conferences. I will now turn it over to the three of you, Carolyn, Liz, and Sam.
Thank you so much. We really do appreciate that excellent introduction and the opportunity to meet with all of you and to cover this important topic. And so thank you so much, Lewis, and especially for the great work y'all are doing. It's great to be partnering with you on this. So my name is Carolyn Phillips, and we are indeed going to be talking with you and taking that deeper dive as we explore and let you know about this awesome project that we've been working on with the CDC, Centers for Disease Control Foundation. And the whole focus, much like you were hearing Lewis express and explain, it is about accessibility. It's really about inclusion too. So accessible materials and culturally relevant messages for individuals with disabilities. And I think a lot of y'all understand how important this is. And also, I really appreciate the CDC and the CDC Foundation for jumping in and supporting and creating this whole project. And so we can move to the next slide. And as we get started, we wanted to give a big shout out and a big thank you to our funder, the CDC Foundation. The webinar series that we have done that's all focused on accessibility and culturally relevant messages, it's made possible due to the funding from the CDC Foundation, along with technical assistance from the Centers for Disease Control and Prevention, which is right here in Atlanta, where we are. And we'll move to the next slide. And Lewis, when I heard you talking about our center here at Georgia Tech, we are indeed within the College of Design and the Center for Inclusive Design and Innovation. If any of y'all are ever in the Atlanta area, I extend the offer all the time. It's definitely worth seeing once we have moved beyond COVID-19 and the pandemic. There's a lot of really cool work that's happening here. And that work really, once again, focused on inclusion, accessibility, making, we're right here in Atlanta, which is absolutely where civil rights, a lot of the civil rights movement has taken off, and that is absolutely a part of the work that we do. And so looking at accessibility consulting, looking both at the built environment, but what's the virtual environment look like too? And thinking about information communication technology, ICT. And it also goes all the way back to looking at, how UX, user experience, when we're thinking about design, what does that look like? So accessibility consulting is what we do. We also specialize in STEM-related, so science, technology, engineering, math related braille services. There are literally students all over the country, a lot in the whole Pacific area, that are receiving braille that's actually produced right here in our offices, and where we specialize in that. We also provide captioning and describe audio services, and also help when it comes to consulting, when it comes to services, especially assistive technology and accessibility, working with folks who are deaf and who have hearing related disabilities. Extremely important, that we are being as inclusive as possible. And you'll hear throughout, I am one of those folks that benefits from captioning. I am right now, I have my captioning up on the screen because I need it because of my auditory processing. And I also am one of those folks that benefits from electronic text, right? So making sure that I can, access text and have it read out loud. So I use assistive technology every day. And so I'm thrilled that we at CIDI have this talented team of e-text producers, once again, that are producing electronic text for folks all over the country and even internationally. And we also have an extremely talented team of certified assistive technology specialists and professionals with a wide range of skills. And so we are celebrating 30 years with our Tools for Life program this year. We have been around for a long time. And as I said, we're thrilled to be with all of you today. So we can move to the next slide. And what we were going to talk about here is, what are we going to be going over with you today? This session, this CDC Foundation funded project, along with technical assistance from the CDC, it supports the Georgia Tech CIDI team on creating accessible materials and resources from existing vetted CDC COVID-19 guidance. And that's a very important piece here. We will be sharing information about the project, including statistics on individuals living with disabilities during the COVID-19 pandemic. We're going to share with you some of the history of the project and real-time resources for you as we collectively work to distribute this vital information And we really do need your help, want your help in getting the word out. We've got these great resources and we want to make sure that everyone is aware of it. Liz, anything you want to add?
No, I think we can jump to the next slide, which goes over our learning objectives, and then we'll jump into the meat of the presentation today. So we just have some quick learning objectives because we always want to give you all a direction of where we're headed. But after the webinar, you'll be able to identify 2 ways that people with disabilities have been disproportionately affected by the COVID-19 pandemic. You'll also be able to list 3 targeted disability-specific audiences that will be receiving the accessible materials through this project. And then lastly, you'll be able to name the accessible resources that are available through the COVID-19 accessible materials for people with disabilities project. And we'll move to the next slide. So we're going to spend the next little bit of time talking about the background and purpose of the project. Obviously, what we're providing, drilled a little bit deeper into who needs these resources, how we're reaching our target audiences, and then really and truly how you all can help us. There's a whole piece of the project that we'll get to in a little bit that's all about dissemination. And so we need help in just pushing the information out there, making sure everyone receives them and knows that these materials are accessible and available. And then obviously Q&A, any questions that y'all have. Next slide. So what are we providing? There's a lot going on with this project. And, you know, as Lewis was giving you the overview and as Carolyn is talking, there are very specific audiences that we are working with to provide outreach of these accessible materials. So when it comes to the scope of this project and the materials that we're providing, we are providing a technique for developing ASL, American Sign Language video scripts that use native ASL. And this is all for more effective communication with individuals who are deaf. We're also providing easy access to Braille, embossed or digital for refreshable Braille displays. We're also focused on simplified text. So this is text that's simplified below the standard plain language guidelines. And then we're also doing web accessibility and best practices beyond Section 508 compliance. I think most of us on here that are familiar with ADA accessibility accommodations, we know what Section 508 accomplishes, but our practices, especially when it comes to web accessibility, making sure that anyone out there using assistive technology that's maybe using a screen reader or other aspects to access these materials, we want to go above and beyond. So we are implementing those best practices beyond Section 508. And then lastly, it's all about education and training, resources to support the dissemination of these products and really just getting it into the hands of folks that need it most. Next slide. Sam, do you want to cover some of the specific audiences?
Yes, absolutely. So we have targeted specific audiences for this project. And so those audiences include deaf or hard of hearing users of ASL. So those would be who the videos that Liz just talked about are for, people who are blind or vision impaired and use Braille. So we do have those either embossed Braille or the digital Braille. Individuals with extremely limited literacy skills. So we're going to go into a little bit more in depth on how those resources were created and we're calling them easy to read resources. And so we'll go a little bit more in depth about those in a few minutes. Also, individuals with mobility issues that limit access to information. We're also looking at families, caregivers, and various healthcare providers who may benefit from the enhanced modes of messaging. And then lastly, individuals who may have combinations of these disabilities and some of the message formats that may be used by multiple audiences. And so these are just our target audiences. We definitely have had people request our resources from public health departments. There's been airports who have requested some of our resources. So we've had a broad range of people who are wanting these and helping us get that information out there. You can go to the next slide.
All right. And I'm excited. Thank you so much, Sam and Liz, in providing some of that foundational information. This is just additional information when it comes to understanding how the project, what's the background and how it really kind of the spirit behind it. The COVID-19, absolutely. I think all of us are aware of this. Has disproportionately affected many groups, including the 61 million folks in the United States living with a disability. While the COVID-19 guidance on the CDC website is accessible for some people with disabilities as required by Section 508 of the Rehab Act, for example, those using assistive technology devices, it has closed captions on videos, etc. The content is needed in alternative formats such as simplified text, Braille, and American Sign Language in some of the videos. So taking that next step and looking at successful practice in alignment also with Section 508. It's also important that COVID-19 guidelines are not only accessible to people with disabilities, but also consider the cultural challenges that folks with disabilities face while trying to follow some of these guidelines. And that has been part of the foundational piece that we have been working with and really building upon in order to successfully get the word out and make sure that we are being inclusive, respectful, and as accessible as possible. And we'll move to the next slide. So as we're talking about, how do we make sure, right, that we're meeting people where they are and really going beyond accessibility guidelines? All individuals with or without disabilities, we all have our own preferred learning modes. And offering products in a variety of formats, it really does provide greater access for everyone. So going beyond accessibility considerations to address those preferences, it introduces some products with wide range benefits, and we're seeing that manifest. For example, those may include videos with some practical information on cleaning surfaces and computers, and mobile devices to avoid disease transmission. It can also include how to sanitize durable medical equipment or how to use touchless strategies for grocery shopping. And we'll move to the next slide. So one of the things that one of the many things that I was excited about with this project is that folks are listening and actively wanting input. And we literally asked folks from throughout the United States for input. And we appreciate, I'm sure some of the folks that we communicated with are actually on this webinar with us. And so we appreciate everyone participating as we conducted needs assessments and also message testing. So we did, CIDI conducted needs assessments with individuals with disabilities, as well as organizations that work with folks with disabilities to inform this project. So the end products are really, it's things that y'all helped create, which is incredibly important. And I think that's part of why it's been such a success. The adapted materials have also been message testing. So it's not just saying, hey, what do you need? But after the products have been, developed, it's going into the field and message testing those with targeted audience to ensure that it's accurate in translation and culturally relevant to folks with disabilities. The way that, that really has made a difference, we were looking at Braille, for example, and thinking about how do we actually get Braille, printed Braille, embossed Braille, out into the community where people are that need it. Not everybody has access to, Wi-Fi or broadband. And so, but we need to make sure everybody has the message. We heard amazing feedback, important feedback from our colleagues and friends and community partners, but also individuals who are deaf with the big D, and use ASL, as mode of communication, one of the most beautiful languages out there. And so we were able to incorporate all that feedback into the needs assessment and into the message testing. And that, once again, like Braille, it created a better product, right? And then we've also done some really cool work that you're going to hear about in a second when it comes to minimizing the complexity of text. And that's truly innovative work that we were able to get information, and then create documents that are understandable on so many levels for so many people. So it's a very exciting opportunity, and we'll talk even more about that. I'm going to turn it back over to Sam. Sam. And we'll move to the next slide.
We can go to the next slide. So here we wanted to quickly show you all where you can find our easy to read documents on the CDC website, as well as where the ASL videos will be. So if you go to the cdc.gov/coronavirus, you will find up at the top right corner the link for ASL videos, and there are some currently there, but ours, the ones that we're creating, will be added soon. And then you'll also see the easy to read resources. And so you can find those there. We're really excited that these are on and available on the CDC website. And you can go to the next slide.
Thank you, Sam. And when we're talking about how do we actually improve the ASL videos, and once again, it came right back to working with a lot of y'all and making sure that folks understand that, we've got to, one, make sure that we have videos that are in ASL for all kinds of topics, but specifically for this one. And also understanding that ASL is a primary language. As I said, it's a beautiful language, one of my favorite languages. It's not a translation of English, and that's one of the issues that some folks that we've seen in the past, they just translated directly, into English. It's for individuals who are deaf, that use it. It's a primary language. Videos, they need to be in native ASL. And also, we are working with the CDC on a modified process to develop video scripts that are native ASL. It's really innovative, and it's been great working through that process. ASL users also need, easily identifiable videos, need to know that the videos are even out here, and messaging about CDC guidance through channels that they use frequently. These are some of the many findings that we were able to get through those interviews, through the needs assessment, and also through the message testing. And I'm very excited with some of the end products that are coming out. And we can move to the next slide. So making Braille easily available, and making it in so that we can get information both digitally and embossed was extremely important, is extremely important. So we have created Braille ready files. There are so many folks, and this has been so exciting to see how many people now have refreshable Braille displays. And a lot of people just want to have documents that are ready for them when they show up. And so that's what we've been able to do in the Braille aspects of this project, making sure that documents were remediated for accessibility and that they're available for download to refreshable Braille displays without any real issues there. So please help us get the word out and download those documents. We also are very happy that we were able to get these embossed Braille, COVID-19 materials out. They are available through our extensive network of partners. And just like Sam was showing you, you can go to our website and she'll talk to you in more detail about how all that works. And they're available by individual request, as we said, through the CIDI microsite. So we do want to make sure that everybody is aware of how to get these materials. The digital ones you can just download real quick. And then, of course, embossed, we've been able to get that out very quickly also. We have had literally, thousands of documents that we're getting out within the community. And it's exciting to see not just the need, but also how much people are benefiting from that. So that's great. And we will move to the next slide. And this is another exciting part of our project where we are taking text. As you can imagine, these guidance documents, they are produced by folks who are very well versed and we see this, of course, in engineering or any number of other fields, epidemiologists, that there are terms that are on, college reading level or definitely high school reading level. And so making sure that we're able to keep the meaning of the text and simplify it so that folks can indeed understand what we're trying to convey and that there's actionable ways that folks, can act after they read the materials. So simplified text, our colleagues, Dr. Karen Erickson and Dr. Lori Geist and their team at the Center for Disability and Literacy within the School of Medicine at the University of North Carolina, they partnered with us and have done all kinds of great work when it comes to developing this the guidelines for simplifying text and minimizing text complexity. Simplified text is needed for those with limited literacy skills from a variety of causes. We see any number of reasons why people would benefit from that. I am one of those folks that benefit from that because of my learning disabilities, my dyslexia. This requires simplification. It's a lot of people, they go to plain language guidelines and they're like, oh, we solved it. But truly, a lot of the plain language documents can still be, and when we test them, could still come in at 12th grade, 10th grade, college reading levels. So plain language gets us, a certain distance, but it doesn't get us all the way. So this way that we're adapting and simplifying and making all of these texts minimized, the content at or below 3rd grade level is what we're looking at. When we're simplifying, that's the level that we are going for. And as I said, this process and a tool has been developed by our partners at UNC. It really is groundbreaking research. And I am excited about how we can apply this, the application of this research-based findings, and I'm excited about where this is going to go in helping us across the board when it comes to helping folks understand public health information in general and emergency information in general. So definitely one of those positive findings and very exciting for a lot of us, I think, who are in the field. And we can go to the next slide and I'll turn it right on back over to Sam. Sam?
Yeah, so I wanted to show you all, this is an example of what the easy to read resources look like on the CDC website. And so the example that we have pulled up here is the wearing a mask guidance. And so this was interpreted from the CDC guidance and it has been put in this easy to read format. And so I'm going to read just the first paragraph of it on the left. And so it says, wear a mask the right way. First, wash your hands. Put the mask on your face. Put the loops behind your ears. The mask must cover your nose. The mask must cover your mouth. The mask must fit under your chin. The mask must be snug on your face. Make sure breathing is easy. Mask may feel different. Practice wearing a mask. Practice will help you get used to wearing a mask. So you can see these are all short sentences. They're intentionally repetitive. They're supposed to, just be easier to not only read, but also comprehend. There's intentionally no graphics on these pages. The research that we had found, and even in our message testing, found that actually graphics could be confusing to some of the readers. And so there was an example would be, maybe an arrow pointing between two people that was supposed to be representing 6 feet of space or distance. Some of the people who participated in the message testing actually found that they thought maybe they were mad at each other. And so all of this is very intentional, and we're excited about this to be able to hopefully get people to read and understand the guidance here. And we can go to the next slide.
All right, and I agree. Sam, you said that well. It is intentional, and it is really focused on how we can help everybody understand, which is great. So once again, focused on inclusion and accessibility. We are also excited that we were and are able to provide that 508 that consulting when it comes to accessibility. There are a lot of folks, and I'm sure y'all have met and worked with people who and especially at this with the awesome Pacific ADA Center, where they say, oh, I'm ADA compliant, and it's like, oh no, that's kind of the minimum, right? What we really want is folks who are willing to stretch, right, and go beyond and really think about that. That's the minimum. And so what's the spirit of the law, and really what does inclusion look like? What does accessibility look like? And that's what you see manifesting in this project. So we have done extensive testing and provided all kinds of recommendations when it comes to best practice, successful practice. It's been exciting to see that, yes, accessibility sometimes requires best practices that go beyond Section 508. A web page accessibility is important to consider when we're looking at some of the guidelines that exist out there, WCAG web accessibility guidelines. And, there's 2.0 and 2.1, 3.0 is being tested right now. I know I provided comments recently on that. But thinking about how do we really make sure that everybody, whoever shows up can access that information. And once again, think about its understanding, but it's also making sure that it's actionable, right? That people know what they need to do after they have been to the website. PDF remediation is another one of those areas that we have been very happy to be working on with this project. And once again, looking at how do we make all documents, but PDFs, that's one that's out there a lot, available, accessible, and friendly, so that whatever screen reader that you use or I use, that it'll work and it'll actually be read out loud. So the cool thing about this is looking at applying all the the compliance that's out there, but also the guidelines, and then taking that to the next level. And there's been a lot of exciting developments and end products that have come out of that. So thinking about all of that is exciting. Producing all of this is exciting, but truly it only matters if people help us get the message out, if people actually access it. It's my dad used to say, it's not what you start, it's what you finish. And so Liz is going to talk to you in more detail about what we have done when it comes to reaching our target audiences. And so we'll move to the next slide, and I'm going to give this right on over to Liz.
Thanks, Carolyn. So you've all heard about the project, and you've heard about the materials that are being modified to be accessible and that are out there. And so now we've come to the part of the project that's all about dissemination, education, and outreach. And so this is a big deal because we've got the materials. And so it's a thoughtful approach of how are we going to get it out there and what does that really look like? So our dissemination plan for this project specifically has been a tiered approach to partner with organizations serving target audiences. So those target audiences that Sam was talking to you about earlier, we are really having a thoughtful approach about reaching out to very specific organizations, other groups that are serving those audiences. We capitalize on existing channels to reach those who need these accessible resources. Our partners, they have partnered with us in this project, and it's been absolutely instrumental. So AAHD, the American Association on Health and Disability, it's been awesome working with them, and also just having that collective voice to reach out to other organizations and explain this project and talk to them about how they can help us provide that outreach. Next slide, please. So when it comes to dissemination of content and all of the messaging for this project, identification of potential dissemination partners was undertaken with CDC Foundation, as well as other partners on the project as well. So we absolutely had quite a few brainstorming meetings where a bunch of entities working on the project got together, and we literally just filled out a spreadsheet, and we organized it by the target audiences that we're reaching out to for the project, and then just went through the list of national organizations that could possibly help us out. What we did shortly after identifying those potential dissemination partners was host a national webinar on the project for those partners that really taught about details of the partnership and what that meant. So we did that on November 11th, and that webinar is actually out there and archived, and we encourage folks just to listen to it, view it, whenever you have the opportunity, just to learn more aspects of the project. And we'll talk about how to access that and other webinars and trainings from this project as well. We want to make this easy on anyone that's helping us distribute information. So what that means is that we're doing all the work for anyone out there that can help us distribute. We've made messages available for outreach and social media through the use of templates. So if you are representing an organization and you reach out to us and say, hey, we're interested in being a dissemination partner, and we want to put this on our website, we want to tweet about it, we want to put a post on Facebook and Instagram, and do an email blast, we have all that ready for you to go. We have a template of an email outreach letter, and then just different posts for different social media platforms as well. So again, we don't want this to be difficult. We know that it can be a heavy lift depending on the size of the organization and that outreach. So we want to make it as easy as possible. And then of course, we just encourage folks to ask us, what else can we provide to make it easy on other entities to help us spread the word as well. In addition to that, we have Sam and Carolyn and I have been meeting with organizations that just want that one-on-one time with us to learn more about the project. And so that's also just been a great way to develop those relationships, but to also just explain in detail, meet people, and then again, just help them understand accessible materials and the best ways to get that out there. Next slide, please. So webinars and trainings, it's been exciting to see the amount of people registering for these webinars, and just a thoughtful discussion, just like what's happening today as we're talking to y'all behind the scenes. So we have a whole aspect of our project that was all focused on webinars. And so we created content for additional webinars, and these have been hosted. We actually just wrapped up our last one in this particular phase of the project yesterday. So all of these have been recorded and archived, and you can access them on the Georgia Tech microsite for this project. And there's a link right there that actually takes you directly to the training page. But since November, early November, we launched this webinar series, and we've been covering a variety of topics. And as we are discussing each of these topics, we are obviously tying it back to COVID-19. We're referencing CDC guidance, but also just talking about these accessible materials and accessible guidance as well too. So back in early November, we hosted a webinar that was all about apps for promoting independence and safety. And even with that, you know, we talked about apps that can help with social distancing, that can keep people safe, you know, different prompters that people might need, you know, for washing their hands and what have you. So all sorts of really cool assistive technologies and apps that can help support people during, you know, experiencing COVID-19 and the pandemic. Sanitization of personal durable medical equipment was another one that we did in November. That was that is unbelievably important. I am a power wheelchair user, and I was definitely concerned about what my life would look like during COVID and all the equipment that I have to use and my caregivers helping me out. So this webinar specifically focused on how individuals with disabilities and their support circles can keep, you know, just equipment and different tools that, you know, folks use every day to be independent, clean and sanitized, and just making sure people are staying healthy. In early December, we took a closer look at face masks in people with disabilities. That was such an awesome session. We had a really great time presenting that one, lots of thoughtful discussion and questions as well. But, you know, face masks, as simple as the concept is, it can really, you know, provide some obstacles for people with disabilities. I, again, am someone that am completely unable to put the mask on myself. So what does that look like if I'm out in public and I've got my assistants with me? You know, so just making sure that, you know, people are safe. But it's not just about putting a mask on, you know, looking at masks that have those clear windows as well too, you know, for individuals that need lip reading as well. So there's just lots of options out there. And so we took a closer look and dive deeper into that. We jumped into mental health and resilience within the disability community during COVID-19. People with disabilities are absolutely resilient in general, and especially during this time. It was really awesome to just have an awesome panel on there, just talking about the different strategies that people with disabilities implement during quarantine, and how to keep our mental health strong. Any one of us, no matter what your situation is, we've all been through a lot during the past year. And so that webinar definitely dove deeper and shared some of those strategies and solutions as well. In late January, we focused on social media, making that accessible for people with disabilities. We're really excited to say that we actually published an article through this project in Exceptional Parent Magazine, all about social media accessibility as well. And so we'll be sure to get that over to our hosts, and hopefully they can share that link when they post the archives as well too. So that was a very exciting webinar, and, you know, very relevant because so many folks are getting information about COVID-19 and protection through social media, especially people with disabilities. And then lastly, like I said, yesterday we wrapped up, we took a look at guidance for business and employees and considering the needs of people with disabilities during COVID-19. We actually co-presented that with the Southeast ADA Center. And so that was a great webinar again yesterday, looking at businesses and employees with disabilities, and just talking about what that would look like if you are an individual with a disability who is not only shopping and a customer, but maybe you own the business as well too. And so just looking at those strategies out there as well. So
You know,
we'll jump. Oh, go ahead.
Liz, I was just going to add, and I'm so glad, you know, that you went into detail with some of these webinars, because in brilliant, Liz was the lead. She's very humble. She and Sam both on pulling this together. But some of the apps, for example, some apps that we knew early on during the pandemic that needed to be created or needed to be utilized even more. You know, it's exciting to see how all of that has evolved. And I think that a lot of folks aren't aware, for example, you know, of the apps that were created, just like you were saying, Liz, for social distancing, you know, spaced social distancing, 1.5. My Shield, social distancing alarm, right? Safe Spacer. Those apps did not really exist the way that they were, and the way that they are a year ago. These are absolutely apps that have saved lives, and they continue to provide that important information. The iPhone 12 Pro has a people detection app. A lot of people aren't aware of that. A lot of the smartwatches now will give you a countdown if you want, or sing a little song as you're washing hands. So some of our folks have really benefited from that. We have also found, and Liz, I was so glad you brought up the mental health webinar. That was an eye-opening and really important conversation, and a lot that we were able to share with folks about how lighting, for example, can really help, how we can use technology to make our spaces more friendly and really help us when it comes to all of those things around mental health, and really making a lot of what we're trying to navigate through individually, but making it, a collective experience. So some of the smart home technology, and you spoke a lot about that, but other folks have really benefited from that. And, I think some of the examples the other day, I was actually talking to somebody who has a disability. They have a difficult time because they have they didn't have an ear altogether because of an accident, and the other one, they were just, their other ear is super, super sensitive, and they wore a hearing aid. And when they wore a mask, it was very difficult trying to keep that on. So, we sent them information about how to adapt a hat or adapt with buttons, right? So you can attach your mask that way. And a lot of times what we're seeing is the double mask now. And so able to do that with a bandana too. There's a lot of different ways. It's one of the things I love about our disability community is how we are creative problem solvers. I run into it all over the country, all over the world, that folks are problem solvers and collectively working together, coming up with these solutions. And, Liz, yesterday, when we were doing the webinar about guidance for businesses, I really appreciated all those important tips that you were sharing when it came to how we can modify the environments, and that honestly, a lot of that is stuff that we within the disability community have already been doing. Now, ventilation systems, that's becoming increasingly more important, and we're finding that in the guidance for the CDC, but we're also seeing that businesses are listening, and employers are listening to their employees. Here at Georgia Tech, a lot of our buildings have gotten brand new ventilation systems directly as a result of trying to be more inclusive and keeping all of us safe, which is important. And then also thinking about, the various policies that have been adapted, the way that so many businesses are looking at how we can make the work environment much more friendly for everyone. So it's an exciting time for sure, and I'm excited to see the way that we're able to navigate. So I hope you will listen to Liz and actually listen to some of those webinars that we put together and share that information. So it's very, very cool information for sure. So Liz, I'll turn it back to you. I just wanted to give you a big shout out for that.
Oh, I appreciate it. And I appreciate you helping me expand more on the webinars, because I think often, we think about apps for promoting independence and safety, and we're just going to talk about what apps are out there, what apps are hot, and especially thinking about COVID-19 and the pandemic. there are so many assistive technologies and apps available out there. We have to get creative on how we're using it. So definitely encourage y'all to check deeper into some of these webinars and access these strategies that we've been working on throughout this project as well. So we'll go ahead and jump to the next slide. And I'm going to give it to Sam. This has been such an awesome fruition of this project. So Sam's going to talk to y'all about the microsite.
Yes, we have developed a microsite. The link here is at the bottom. It's cidi.gatech.edu/COVID. And so we created this site to house all of the documents that we're creating. And so we have we're hosting all the accessible materials there. We have our links to the trainings and the resources that Liz was just talking about. So all of those are archived on our microsite as well. There is supplementary resources that are on there. And then we've also linked back to the original CDC guidance. And so I would like, if possible, to share my screen and show you all. I think that might help to visualize it a little bit more and get an idea of what it looks like. I don't know if I'm going to be able to. If not, that is okay. I recommend you all to check out our website here. It's pretty easy to navigate. You'll see at the top, you'll be able to see our resources by accessibility type. So you'll find our Braille resources there. So if you go to the Braille resources, that's where you are able to download the digital Braille, or you can request the embossed Braille from a request form there. You'll be able to see our accessible Word documents and PDFs. Our ASL resources will also be on our website once those are available. We have a first batch that have been filmed, and so those will be posted hopefully very soon. So those will be coming soon there. And then we also have the easy to read guidance that you saw on the CDC website. We have the same guidance here on our site too, just so we have everything in one place.
Hey, Sam, this is Lewis. We're going to be giving you screen sharing privileges right now, okay?
Oh, thank you, Lewis. Sorry to throw that on you there. All right, so here's the microsite, what this looks like. And this is where what I was just going over here, the Braille resources, the accessible Word documents and PDFs, the ASL resources, and then the simplified text. So I want to show you quickly what the Braille form looks like. So if you wanted to request Braille documents, you would click the button there that takes you to this form, and it has at the bottom all of our documents that we have available to be requested in embossed Braille. And so go back here. All the documents are here for you to be able to view as well, so you know what you are requesting. And then the other thing I wanted to show was the easy to read resources. So as I mentioned, you can view them here at the CDC site. We've linked that, but these are all the same resources that you'll find there also on our site. And then at the bottom here, if you are interested about how those resources were developed, finding more information about the guidelines for minimizing the complexity of text, there is more information about that here. So just wanted to show that also. And then here, if you go down to the additional resources, you'll find related articles and updates. There's a few articles and press releases and things like that that we have archived here. You'll find our webinars and trainings archived here. So these were what Liz had just gone over earlier. And so all of the webinars that we've done, you can find here. And we're also offering credits for these webinars. So we're offering CEUs and CRCs that are still available. as long as you just email us and let us know that you have watched the webinar, and then you'll be able to request those CEUs or CRCs if you need those. And then we have some more information about the CDC and the CDC Foundation and our partners through this project. We have listed here as well. And so there's a lot of great information on the site. And again, this is going to be your one-stop shop for all of our, I didn't mean to click that, for all of our accessible resources that you will find right here. So we put a lot of work into this site. And we're excited to be able to offer this and for people to have a place to come to find, this accessible COVID-19 guidance. Is there anything else that Liz or Carolyn want to add to this before I stop sharing?
I just wanted to, say once again, give a shout out to Sam because she was leading this effort with Liz and Shayna and our team. But this whole design it was also about UX, right? User experience, and having people that would benefit, the end users, right? Those of us with disabilities be able to weigh in and say, this is what we need. So lots of thought, lots of effort, but also a lot of input, and we appreciate everyone that has weighed in to help us throughout the whole project, and especially with these end products for sure. So I just wanted to make sure I added that part. So thank you, Sam.
Would you guys like us to return to the to your PowerPoint?
Yes, that would be great because we have just a couple of more things, and we absolutely want to answer your questions. So we'll move to the next slide. And thank you so much, Sam and Liz.
So we just have an email address here. It is training@gatech.edu. So training@gatfl.godtech.edu. And it's was typed into the chat there for all of you. This is a great way to reach out to us to learn more about the project. If you are representing an organization today and you are interested in becoming a potential dissemination partner, we absolutely want to hear from you. We would love to not only feature you on the microsite, your logo, but just spend some time with you and give you those templates of information, the email outreach, the tweets, the social media, anything that you need. We would love to be able to supply you with that so you can help us distribute this important health information. And it really and truly can be a matter of just putting a link on your website and directing people back to this microsite, what have you. So there's all sorts of creative ways that we could utilize your help in just dissemination, outreach, and just education of the project and accessible materials for folks out there as well. Carolyn or Sam, anything additional you'd like to add?
No, I think that you covered it. So those, having that outreach collaborative, it really has just paid off. That is for sure. So we mean that if you would like to be our partner, we absolutely would love to partner with you.
So we'll jump to the next slide. And we want to know what questions you all have for us.
All right, thank you so much, Carolyn, Liz, and Sam. That was a great presentation. There's a lot of enthusiasm in the chat room, and I want to sort of get to some of these questions so that they can be answered. But before we do that, I just want to remind people that this is a good time to submit your questions in the chat window, and we'll get to those as we can. Okay, so the first one that I think is important is somebody said, I don't want to assume that I understand, so please, what is native ASL?
So this is Carolyn, and I'm happy to address that. So what we mean when we're saying native ASL is a lot of times folks will, when they're making videos, for example, and we've been trying to educate people about this, is they'll take an English script or a script in any other, written language, and then they'll translate it kind of word for word and expect that, okay, well, that makes sense. So native ASL, it really is not necessarily what somebody that would, be an interpreter necessarily. It's what's really utilized, how we really talk with each other, kind of the way we would, say native about other, it's our the language that we use in real conversation. And so, we often talk about native tongue, or, here in the South, we'll talk about, our native, language, where we're really just talking about how we communicate. So that's what's meant there, that it is, it's moving away from and really making sure, just like with any translation, that it's a true and honest understanding and translation of the topic, so, and of the information. So I hope that helps answer. It can go into much more detail, but that's a quick answer.
Right, let's go to the next question here. Someone was asking, is there a timeline for releasing the additional ASL videos? They said they look great and I don't want to reinvent the wheel for our own materials.
Yes, absolutely. And I did want to say one other thing about ASL. It's, as I said, beautiful language. It is a visual language. It's a graphic language. It's a physical language. And I think it's important that people realize that. Yes. So our timeline, we actually have about 29 videos that are in production, actively in production right now. And we're about to release, my guess is next week, next Wednesday or Thursday, there will be a whole batch of new videos all about COVID-19 with the latest guidance. And it will be released on the YouTube channel, the CDC YouTube channel, and we'll also have links on our website, just as Sam explained.
All right, next question. When developing easy to read test, did you try to follow it up with a video plus reading the text?
So, with the easy to read text, what we were doing is utilizing and looking really at language in general. All of those documents can be read by a text-to-speech or screen reader, and they were all tested with individuals who would benefit. We are actually making some videos that are going to go as we're big into universal design for learning principles, so having multiple ways of expression, and so that everybody can understand. And so we are developing some of those videos, and I'm glad to hear that you asked the question. So thank you for the question.
This crowd has great questions.
I can tell. I love it. These are some of the best questions we've gotten.
Well, here's a really interesting one too. Are there any resources for making the data dashboards accessible to screen readers? And they mean things that were created by Tableau or Power BI, for example.
Oh, you didn't even have to give me the names. I know exactly what you're talking about. And that is something that we are actively in conversation about because those data dashboards are extremely important. And we've explained that everybody needs to have access to those. And so we are talking about some solutions, looking at ways that everybody can have access to that data and those data dashboards so we can make informed decisions about where we want to travel, if we need to go somewhere, what we need to think about, what does that really look like when it comes to infection rates or what have you in our own community. So I hear you, and I totally wrote that down, and we will bring that up again. Thank you. And I'm glad to hear that somebody else is concerned about that.
Great. All right. The next question. The hard of hearing community has been significantly impacted by the pandemic. Only a small percentage of these individuals use ASL as a primary mode of communication. Excuse me. ASL is critical for those who need it, yet by focusing on ASL, you are leaving out those who are most impacted. How can we assist you in developing messaging and education that supports where I lost it, the 48 million Americans with hearing loss?
Yes. Once again, excellent question. And we are on the same page. We have that as part of our message and education that we're also trying to do. Would love to talk to you in particular, the person who asked the question, more about that, because we hear you, we're with you, and we're advocating for the same thing. We have found that a lot of the videos, and I'm not talking about CDC videos, I'm talking about in general, when it comes to public health, that they have not been, considered looking at guidelines or even, thought about how do you do the captioning, let alone, audio description, right? And, honestly, there is some really great captioning. As somebody who depends upon captioning, there's great captioning out there, and there is really bad captioning out there. I'm concerned about how many folks are moving to AI, artificial intelligence, and that concerns me. They think that's the solution. I have seen incredible misinformation through artificial intelligence and, through the captioning. And so I am with you. And yes, if I could get your information, definitely would love to talk to you in more detail. We are going to be producing actually a journal, a whole journal, is because we have so much information that we want to convey. This is one of the articles that needs to be in that journal, and would very much like to talk with whoever shared that information and ask the question, because we need to raise the awareness for sure. That is something that we're committed to, by the way. If you look at our videos, what we're trying to do is also show excellence, and here's how these captions look when you follow the guidelines. So I'm with you.
So the person who wrote the question was from the Hearing Loss Association, and that's how they've signed in. But if you're seeing this on the captions, please put your contact information in the chat window so that the speakers can contact you afterwards. Or if you guys do you have a slide of your contact information? No?
We might. Yes, let's actually, yep, I'm wondering.
Yeah, there we go. Okay, yes. So for the person from the Hearing Loss Association, go ahead and write directly to them to connect with them about that. All right, excellent. Next question. Regarding the templates you have for reaching target audiences, if someone uses it, do they just add their local resources, or can they modify them to be appropriate for their local community?
Liz, I can turn that to you.
Yeah, absolutely. Yes, we want you to add your logo. We want you to modify where these templates that we're giving, they're just a basic structure. So for example, it could be a tweet about face mask and then pointing people back to the microsite or back to the original guidance on CDC. So it's just making that connection. So absolutely, we make it to be like a framework, and we want y'all to put your language around it as well. So it's just a good, healthy combination of a mixture of what we've got and then what y'all want to do as well. So absolutely customizable.
Great. Next question, and maybe your emails is enough, but the one person is asking, how do we contact you about social media messages?
The same way, and also that training email that collectively goes to myself, also to Sam, and to Tori Hughes, who is on our team. And Tori is one of our, she's our outreach specialist, and so she's the one kind of behind the scenes working with me and Sam on some of the more of the outreach and the webinar organization. So either way, the training email goes to 3 people, or you can reach out to any one of us, Carolyn, myself, or Sam. We're happy to talk to you more about that.
Just to respond to some of the questioners, the slides are at adapresentations.org if you want to do that. It will be archived. All of this will be archived, including the recording. That'll happen next week at ADA Presentations in the archive section. So that's, I just wanted to make sure that people understood that. One person asked, are there any fees to use your resources?
No fees at all. We, don't want to create obstacles or barriers. There are too many obstacles and barriers out there, enough for everyone, but obviously, especially for folks with disabilities. So no fees at all. These resources are, straight from CDC. We're making them accessible, and we want to make it as easy, as simple as possible for folks to access it. So no fees, they're free, and we absolutely encourage y'all to go check it out and access them.
This is a question that I think it's important for you to answer. I'm not sure if they're asking to us, but maybe you guys can answer. Can you use live transcription in Zoom in place of an ASL interpreter? And I'm going to answer after you as well. Go ahead.
Okay. No, you cannot do that. That's my opinion, but it's also our experience that, using transcription instead of an ASL interpreter, once again, it's a language that, ASL is a language. And so our presentations, we have, live interpreters with us, and we also have our own captionist on our own team. So so very important, and it's a good question. So, I don't want to embarrass anybody by asking that question. That's the only way we all learn. But yes, no, different. So.
Right, and I want to follow that up because I'm not sure exactly what the question was getting at, but this may also be a question that you are wondering about in terms of the Americans with Disabilities Act, and so do feel free to call your regional ADA center at 1-800-949-4232 if you think that you have a question about, if the question is, what does the ADA say about this in terms of what your responsibilities are, okay? All right, next question. We are having issues in North Dakota and Minnesota where people with disabilities who are not able to use computers or who do not have access to computers are unable to sign up for vaccinations at the pharmacy sites because they are only offering sign up by computer. In the past, hospitals and clinics would allow people with disabilities to sign up by telephone, or someone would assist with the computer sign up. How can this be addressed in a way the pharmacies offering COVID vaccinations allow phone sign up? This may not be something in your wheelhouse, you guys. So let me also say this kind of a question might be one that you may want to call your ADA center to talk about the responsibilities of these places under the Americans with Disabilities Act. I just want to put that in there in case you have, if you have anything to add, please do.
Honestly, Lewis, that's exactly what we would say, and we would say, we would be connecting and asking, what state are you in, and let's get you connected with your ADA center. Great question, and we have run into this exact situation all over the country, and we are continuing to raise awareness about it directly with folks who we hope can make the difference and change that. But it takes all of us.
Right. And I think that connects with another question that came in where somebody asked, are there any resources available to provide communication access at COVID-19 vaccination sites? So I don't know if you guys have anything related to that. If not, I would again turn the questioner to talk with your ADA center about the responsibilities there.
Yes, much like what we're in the work that we've done with FEMA, which Liz and Sam and I have done quite a bit of work with FEMA, with a lot of our partners around the country, and the Assistive Technology Act programs that every state and territory have. A lot of us have loan closets, and so making sure that folks have access is extremely important, especially at that point where there is a service, which would be the vaccine being provided or what have you. Multiple ways to solve that, and so once again, I think it's about raising awareness and also making sure that people understand that we've got to have communication, we've got to have the technology, and we want people to think about us before we show up. And I think that's one of the important themes in general, but we've just got to do that. So there's a whole webinar Liz and I have done years ago around technology during emergencies, and unfortunately it's still needed because people haven't gotten the word as much as we would like, but yes.
Okay. Again, some questions coming up. For the screen reader user, yes, the links that they were providing are in the slides. If you want to just download the slides, you'll be able to get to those links as you can. And then for the three of you speakers, people were putting their contact information in there, so in the chat window. So I want to make sure that you get that before we end soon, so that you can follow up and connect with these people. Another question: what types of resources are you developing for people who are deafblind?
So actually, that is one of the things that we've been talking with a lot of folks. A lot of our research at our center is done with an N of one number, like just one person sometimes. And our UX, our user experience testing for design of technologies or products or websites or what have you, sometimes just done, tested, with one or six people or what have you. Thankfully, in Georgia, we have a really dynamic community of folks who are deafblind and very active, and have hosted symposiums and trainings, and definitely had folks who are deafblind that were a part of our users and our, and some of our testers who participated in the focus groups for this project in particular. And that's part of why we have transcripts. Sam and Liz have done an outstanding job making sure that we have transcripts for and all of those webinars, that that they are accessible, and so people can use, if they have a refreshable braille display, for example, being able to use that. Also, thinking about transcripts for the ASL videos or any number of other products that are out there. and just thinking, what is it that the community needs? And that's what we're talking about, that it's exciting, seeing how so much convergence is happening, where we have folks who, for example, that are deafblind, who have let us know that they really appreciate the minimized text complexity. It's very clean, very simple, very easy. Whether they're using a screen reader or if they're having somebody actually interpret it for them in real time, or if they're using a refreshable braille display. So we've put a lot of thought into that, and we absolutely are open to even more suggestions. So great question, and thank you very much.
All right. Gabe, if you can go back to the slide where they had the their presentations near the end. Somebody wanted to make sure they had the address for how to get to that. And while we do that, there you are for the person who asked about how to get those trainings. There's where you find that. Let's see, I'm sorry, I'm losing track of where my other question was. One person was, the person was following up about the live transcription and asked about what we're using on this session. And in fact, we are using a live captioner. It is the fantastic Beth, who is with us every week, or every month, I should say. So she is there listening to us and providing captions for us today. Okay, and I think we're going to have to end there. So we realize that many of you may still have questions for our speakers, and apologize if you did not get a chance to ask your question. If the question is an ADA related question, please contact your regional ADA center at 1-800-949-4232. Otherwise, you have the contact information for our speakers, and you're welcome to give them a contact if you have further questions. You will all receive an email with a link to an online session evaluation. Please complete the evaluation for today's program, as we really value your input and want to make sure that our funder understands the value of this as well. We want to thank our speakers today, Carolyn, Liz, and Sam, for sharing their time and knowledge with us. It was very informative, and I think the chat room is full of enthusiastic responses. And a reminder that today's session is being recorded, and it will be available for viewing next week at adapresentations.org in the archive section of emergency preparedness, and that includes the transcript that we are pulling from the captions. Our next webinar will be held on March 11th, and we hope you can join us. Watch your email 2 weeks ahead of time for the announcement of registration for that webinar. And again, thank you so much for attending today, and have a good rest of your day. Bye-bye.